What's up, everybody? Lefty here, Party Science. Today I have two special guests, Dr. Sexton and Dr. Bukowski, and I'm excited because, as you can see, I wear glasses. We're here. We're going to talk glasses, a little shop, hopefully. But other than that, thank you for having me. I appreciate you
Thanks for
guys.
coming.
Thanks for having us.
Yeah, of course. So you gave me a little bit of a walk around, and I have to say it's really nice. It feels very modern. It feels very like homey. You get the impression of people who work here genuinely enjoy the profession that they're in.
Yeah.
So for you guys, how did you two start working together, and then how did you both get into the profession?
Great question. Why don't you give
Great.
your
Well,
origin first?
Well, it starts 30 years ago. I started this practice 30 years ago, and then I was a side by side by some big opticals for a while, and I moved to my first totally private office in Norton. I was there for 25 years, and last year we moved to Raynham, so we've been here about a year. But as far as Dr. Sexton, she came in about 4 years ago, 2022 or something like that. And I immediately recognized what a great doctor she was. I've been looking for somebody to work with as my career goes on, and she's great. Within 2 years, she was a partner, and we provide great care. I like primary care, geriatrics with some older patients. She sees pediatrics. She's a pediatric specialist, and we both do everything, and we work together, and yeah, we got a good thing going.
Yeah. I graduated from optometry school in 2016 and kind of bopped around at so many different jobs, mostly different franchises. And everywhere I went, it didn't feel like home. It was very cookie cutter, and you felt like you were working for the man. And I had twins in August 2020. I was supposed to go back to work at the establishment that I was at after 12 weeks of unpaid maternity leave. At 5 weeks, my boss asked if I would come back part-time, 5 weeks postpartum with twins, and I said, not coming back at all. And that was one of the biggest blessings in disguise because I was freaking out that I didn't have a job, that I was going to be home by myself with twins. But then I saw an ad that Dr. Bukowski was looking for someone part-time. And so as soon as I visited the practice and met him, it was kismet. I could tell that he had built something really special. And it's a testament to him and how he practices and his values that his office manager, our office manager, Sandy's been with him for 30 years. Melissa, who's one of our amazing staff members, has been with him
25 plus
something years.
More.
It was clear it was a family patient-centered practice, and that was what I was looking for. And so yeah, then that led to conversations about me becoming junior partner, becoming more full-time. And then the universe had some other plans for us. It wasn't necessarily on our 2025 bingo card to move the office.
No.
But
we needed it anyway. We were growing. We found ourselves running into each other at the other location anyway. It would have had to happen in the near future anyway. So
Yep.
It was rough to do everything at once, but now we're here and we're settled. And it's
been our new home for about a year now.
right.
So-
COVID hit everybody hard, and with medical practices, it was rough for all of us. You stayed home for a little bit, and I was the only doctor in this practice for a few years. It was tough, masking, the whole thing, the screens, and that was just a tough time. And I had built this practice, and I got a wonderful problem. You think I was too busy. I couldn't see all my patients, and so I've been looking for somebody. I took my time, and yeah, Dr. Sexton we have the same values, philosophy, and I can ask her. She's really good. I've been doing this for 32 years, but she's just as smart. She knows her stuff, and glad to have her.
Yeah. Yeah, it's a nice, I think that we have a good mix. I have a lot that I've learned from Dr. Bukowski. His patients love him. which is amazing as a person coming in and wanting to be a part of that, but also can be a little daunting when you're like, am I going to stand up to, am I going to be able to hold my own? And the patients have been incredible. They've been so welcoming to me. And then with this move to the new location, we have more visibility, I think, from the road, and Google reviews has done beautiful things for us, where we just have been getting a lot of new patients too. So I've been
Nice.
able to cultivate that on my side of the practice, and he's able to maintain, and
Congratulations
he's
on all that. That's
established.
awesome.
Yeah, it's been great. And I think, I come in with a certain maximalist energy, and I
What do you
obviously
mean? What do you mean? Explain that to me. What is?
I'm extra, and I
No,
love eyes,
what
and
do
I
you-
love
what?
glasses. So that's what. Thankfully, I asked him about curating the space, and he just was kind of like, "Go bananas." So,
I
figuring
saw
out.
something about resin on your IG or something.
Oh
like
yeah.
Is that, do you think, kind of why you wanted to?
Yeah,
like,
I definitely am very much like a science and art person.
Okay.
I have that both sides of me, and they work well together.
In
So
this profession,
yeah.
sometimes it's an art.
Yeah,
Yeah.
a
Get somebody to see, it's
1,000%.
often an art.
Yeah,
Yeah. I mean, the first thing I did was whip out my phone and record the paintings.
yeah,
Yeah, I thought the frog was, or
Yeah.
not. Yeah, I thought that
Yeah.
was really cool. You know the.
yeah. Dr. Bukowski's wife thrifted these
Nice.
for us.
Well done.
Yes.
Well done, wife.
Yes, she
Well,
knows
very
my
well done, yes.
she knows my aesthetic
Yeah,
very well. I'm
yeah.
a sucker for anything with animals
Yeah.
and glasses. There's a
Yeah, I
few.
saw the cats and stuff there. Yeah, I saw them throughout the
Yep.
location. Yeah.
Yep. Actually, the other little animals with animals with glasses I got from Keeping Pace. Believe it
Nice.
or not.
Nice.
Callback.
Yeah.
And it's nice to come to a practice and be receiving medical care, but not for it to feel stiff and stuffy, for to feel inviting and feel like you matter, and to feel like your practitioner is a real human and can relate to you. So that's what you've seen. We have the tour of my office. There's a lot to look at in there, and people are like, "Well, you must see kids," and I say, "Well, it would probably look the same even if I didn't, because it's just who I
That's your
am."
style. Yeah.
We're a family practice. Once in a while, one of our kids or her kids, or now I have grandkids. When my kids were young, they'd be at the office, and we love to have so families are welcome. There's no problem bringing a baby or anything, or
Yeah.
So
Yeah.
it's
And then you have multi-generational too, with you have sentimentality for a lot of the things in your office as well.
I do. My grandfather was a general surgeon, private practitioner in Western Massachusetts. He practiced from the 1920s to the 1970s. He was a founder of Athol Memorial
So
Hospital.
50 plus years. Is that what you were
Right,
doing?
long time ago. So he's kind of my inspiration for a small practice. And when I got old enough to get into looking at medical school or something to do, general medicine, it was almost impossible to be a private practitioner, but optometry, you could do it. And I thought it was cool. I was wearing glasses, and it was interesting, and I liked the physics and the optics, and it was a good mix of medicine. And I've just always wanted to practice like my grandfather.
What did you
get
see that influenced you so much? from
He
your
told
grandfather?
stories all the time, like of his
Yeah?
patients. And he's 80-something years old, and he remembers this patient and this and that, and he always had, and it was intriguing. Now I have those stories,
Do you have one that you like that he shared that you kind of like, it plays back to you when you think about it, or like?
It's been so long he's been gone. I can't think of anything specifically. Other than he'd have to race to the hospital, which was 15 miles away, and the cops would let him, just pulled him over one time, said, Doc, go as fast as you want, just keep good tires in your road, on your car. This is back before their EMTs and all of it. And he saved somebody one night with that, but that was very intriguing. And he's going like 100 miles an hour, and the cops were escorting him. So that was one thing that I remember, but the specific case I don't remember.
Cool.
Yeah. Well, when I was young, when he was retired, a few years before he died, I was clumsy and I broke things, so I keep him busy, which he liked that because he still kept his medical license. So So literally back in the day, I broke my wrist one day. He drove me to the hospital, walked me in, took an X-ray himself, went over, set a plaster cast. Some people said, "Hi, doc, hi," drove me home. That
That's
was,
so cool.
That's
That's such a
so
good
fun.
That's how
story.
it
Oh my
was
God,
back in,
yeah.
Good story.
a
Wow.
long time ago.
Wait, so this was, where were you? Was this around this area or where?
Athol, Massachusetts
Okay,
is where I
so,
grew
okay.
up, and that's where he was practicing there for many years. So yeah, he was my inspiration in being just being a private practitioner and giving everybody your best, just listening to everybody. Everybody gets the same exam as my mother did, as my kids do, as my grandkids do. Yeah, I mean, and that's just carried me. That's Can't go wrong doing that. It's simple.
Where do you think he learned that? Just to
Where'd he
be,
learn that?
yeah, where do you think he learned that to have that mindset of treat everybody exactly the same, give them the best quality?
It's a good question. Um, I'm so much the youngest that his, I don't, I'm not sure.
But you've always known it to be ingrained in him,
But
is
there
what
was
you're saying.
something to
Yeah,
him. He was
yeah,
just
yeah.
kind. I mean, he just, and we're a lot of like, he's a tinkerer. Like I'm a kind of an amateur mechanic, or I can fix anything. Something breaks at least temporarily, and I'm the professional's nightmare. I'm the one that calls you when I'm in trouble. But he was like that. He used to build things in his basement, and so yeah, I guess we're just a lot alike. And too bad he was 70 something years older than I was. We only had a few years together that I really knew him. So
I
Yeah.
think, sorry,
No,
I was
no,
gonna say, I think that some people, when you think about going into medicine, the medical field, being a doctor, you want your practitioner to be smart. There's a lot of smart people. There's not the level of practitioner that you find, like Dr. Bukowski, who we clearly learned from his grandfather, that actually care about you and your health and your wellness and don't just treat you like another set of eyeballs. You're an entire person and it's your family and it's your community. And so I think some people just have that. So it's probably in your genetics is all.
you know what happens? Even if you just see somebody once a year, you see him for 30 years. You spend 15 minutes, half an hour more if they need it, one-on-one.
Mhm.
Do I spend that much time with even some of my family members one-on-one? And I have thousands and thousands of patients that have been coming to me for over 30 years, um, and it's I'm honored, that they're part of my family. So don't worry, I'm not going anywhere anytime soon. I'm not that old.
No, I mean, you definitely have the energy of someone who wants to stay in the game as long as possible.
Sure.
You know?
That's exactly what he told me. He says, I want to see patients at least a day or two a week till I no longer can.
Yeah.
And that was, I'm
Yeah.
holding him
Let
to
her
that.
do the business part.
Yeah.
Keep passing more of that on to her eventually.
That's it makes sense to why it seems so dear that you care about not letting and just a little bit what you told me off camera in terms of like wanting family practices to still be so incorporated into the communities. I understand it now because it was something that you saw all your life.
Right,
So I get where
right.
that ingrainedness comes from.
Sure.
And then you come along and you're like, well, I feel the same beliefs. I believe exactly from your
Yeah.
own side of the stories, obviously.
Yeah. Yeah.
So it makes sense why you guys come together and you have this environment of
Yeah.
it's very like, come on in and we'll take care of you.
Yeah.
Yeah.
I started wearing glasses when I was in third grade. I went to a small family practice. It was my optometrist and her business partner, and she was rad. She was so personable. She made me laugh, and then she would take pictures of my eyes and she would show me what was going on. And I always felt better leaving the eye doctor than when I got there, even if I was dilated and it doesn't mean it's always a pleasant experience start to finish when you're getting bright light shine, but it's something that I was smiling afterwards and I felt like I learned a lot and felt like she cared about me. And as I was growing up, I knew I wanted to do something medical as well. My mom was a pediatric nurse. She worked in the pediatric ER for many years, went back to school, became a school nurse. My father's a retired police officer. I just come from a community caring family. And when I was, seeing medical school, I thought I would want to be a pediatrician. but optometry offers a better work-life balance
Sure.
without having to do too many nights and too many weekends. And I was able to shadow my optometrist,
So you're good. Yeah, you're
business,
fine.
business partner, and his specialty was pediatrics, and he worked with a lot of um, low vision, special needs children, and just from the cases I followed with him, seeing the impact that that had on the lives of the children and their families, really stuck with me. So that made me want to be an optometrist, and then specifically see a lot of kiddos, and that's awesome seeing them grow up.
I was one of those kids that, for a few years, like through middle school, I would fail the eye test, and somehow that note didn't make it home to my mother. But anyway, and I got away with that for a few years, and so freshman year in high school, I loved playing baseball, and I was on the JV team, but I wasn't playing very much. I couldn't really hit. I couldn't, So I failed the school screening that caught me this time, right? So I got my first pair of glasses, and I'm like, looking at the leaves in the trees, it's like, I could see what's going on. Like, about a week later, I was starting every day on the baseball team, so that got my interest. that plus a medical interest was years later. I put two and two together, So, I think a lot of eye doctors need glasses. That's one of the reasons why we get interested. Oh, look at this is cool. I'd like to do
Surprisingly, in
this.
my friend group I have from optometry school, I have a handful that none of them need glasses, and I'm like, how are you here?
Are you looking at your phone? What are you doing?
We're happy to have you. They are fabulous. But I'm like,
How dare you have good eyes?
how are you here?
What are you doing here?
Yeah. So, how long was your mom a nurse, and before you really kind of paid attention that she was a nurse? Like when did?
So when I mean, as soon as I was born, she was in the pediatric ER. She went back to school to become a school nurse when I was in late elementary school, early middle school, and then she was actually the school nurse at my high school when I was in high school.
Was that her way of spying on you?
Kind of, yeah.
Yeah.
And then my dad was also the school resource officer at my high school when I was in high
So they
school.
knew everything. You were getting it.
away
Yeah.
with
They set
anything.
that up pretty well. That's smart. That's smart
I was a
parenting.
total square, so it wasn't like I was going to do anything anyways, but it
Definitely kept you. They
not
kept you
getting
from being
away.
able to. Yeah.
Making me less popular in the dating pool, but
Yeah. Your dad's down the hallway. We can't. Yeah.
Yeah.
So your mom's a nurse. She ends up being at your school. Your dad's a resource officer.
Yep.
Did they meet at the school, or like how did they?
So yeah, my parents are high school sweethearts. They met in my hometown where I grew up, and their first like official date was their senior prom they went to together. So they've been together since they were 17 years old.
Wow,
Yeah.
that's awesome.
Have me and my brother. My brother is graduating from his medical school residency program in June.
Nice.
Yeah. They joke all the time that they don't know where we came from, but they both have incredible work ethic and worked hard for us to get where we are. So,
Well, I mean, I would assume around kids every day, they probably understood how to work with you guys more understanding. I don't know if it's the word I'm going to use is right, but it's understandingly. I don't know, like they understood how to work with kids better. Let me go that way.
yeah.
Because they were around them all the time, so it
Yeah.
allowed for you guys.
Yeah. I think with me, I was just a weirdly motivated child. So they just tried not to get in the way of that. They were like, just keep doing that, and gave me some direction to try and be more well-rounded, get me into sports, and do something cultural, something artistic. So I would do like singing and dancing and some acting, and yeah, we had our well-rounded upbringing.
Yeah.
Mhm.
So I DJ for a living, and you said
Yep.
something that I just have to ask, and
Yeah.
maybe it implies to just in general what you guys do here. There's a level of performance that goes into what I do as a DJ. Like there's a perception that people have of what I should do or be
Yeah.
when I'm at an event, and if I hit those things right, then they walk away from that party thinking I'm the best DJ ever.
Yeah.
Do you guys ever find yourselves like you've done this for so long, you understand exactly what to say or how to say it to someone
Yeah.
so that it gets the emotional reaction of like you're gonna be okay. Like, how does
It's
that
funny
develop?
you should say that. We've had talks about doing this for 32 years. Once in a while, you get sick and tired of hearing yourself. You know, clear one, clear two. You know, and you do. And I have speeches because I've, I've written them, they're word for word probably, you know, but I have what she does too. Whatever, you know, you have this condition because we see this every single day. So there's a 2 paragraph speech we give. And sometimes I'm like a patient that's been patient 30 years. You haven't heard this speech? I say it every day because you know, but yeah, you get but yes, then you realize you look at a new patient who's hearing it for the first time, and it's just as new, and you're looking them in the eye. You're seeing if their eyes are glazing over, if they understand, if they want you to continue. You know, you read them and then you go back to the clear one, clear two. It's two, or you read how they say it. You know, I mean, and that's an art, and that's something. You know, I know all the science. The science is great too, but the art of doing getting that person what they need, you know, getting to know them. You have to get to know them. They want to see, well, what do you do, what do you need to see? You have to get to know what they see, what their environment is, you have to talk to them.
Right.
So
For me, I say too that I'm like, any any monkey can go shine a light at you and spin knobs and look at something and take notes, but the art comes in developing that relationship with your patient. And part of my like Dr. Ali experience is that at the end I want you to feel like you've been heard, like I've listened to everything that you have said and any questions that you had, and I've answered them in a way that makes you feel like you understand and that you can ask more questions if you need to. So, uh, the clinical part is very important. And I think where we both went to optometry school in Boston, it's a unique experience at the New England College of Optometry because they put even first years in clinic, which is not a universal experience. But they want you developing the personal side of those skills with every different walk of life. In Boston, we're in the community health centers, we're in the VA centers, we're in private practices. We see all ages, we hear every language spoken, all types of humans, and learning how to establish a rapport with somebody and educate them about what did I just do during the past whatever 15 minutes. Let me break that down for you in a way that's really approachable, and that gives people, I think, the greatest satisfaction is that they're like, oh yeah, you did respond to these questions that I had, and I actually understand. People have told me I needed glasses, I never understood why. People told me I have dry eye, I never understood why. That's the missing piece, is the why, and giving them that explanation
right,
empowers them, so that way they can go off in the world knowing more.
answering all their questions. And I have to admit, there are times where I forget to answer the first complaint because it didn't look like that bad, and I saw something else. But I'll call them back. When I finish. So if I forget, I'm sorry. But
Yeah.
always call me.
Well, that's
But yeah.
It's also part of, I think, is having the humility that you're not infallible either,
Right,
because
right.
that happens all the time. The patient starts off at the beginning, and you get derailed by something that seems more urgent from a clinical
Right.
point, and then at the end, and you say, "Oh, I'm sorry." Or
Yeah.
if you ask a question and I don't know the answer, I will tell you I don't know, but I'm going to find out for you. I don't want anybody
too.
blowing smoke. I don't want doctors blowing up smoke, coming up with something that seems silly. I will investigate for you.
Right. Your brand matters to you guys about who you are personally and the connections you have with your patients.
Everything goes around comes around. It's I have a large family. I have 6 sons. 3 mine, 3 hers, all 6 ours, and that's what it's about: treating everybody right and doing the right thing, and yeah, that's everything.
Where do you think, and this question's to both of you, where do you think you learned that emotional EQ to be able to read someone like that?
Comes with practice, certainly. I mean, when we're learning how to do it. It's mechanical. Cover one eye, read the bottom of the chart. We have to memorize the chart. We still can't. Cover the other eye. Yeah, the personal comes. You first train the mechanical, and then after you feel a little more competent in the testing, you start to ease up a little bit. You start to get to know it, and as you get older too, it's very difficult for a 30-year-old doctor to say to a 40-something-year-old person, well, everybody needs reading glasses in their 40s. Yeah, right. It's easier for me to say that now, but things like that.
Yeah. Therapy.
All right. Okay.
I'm pretty honest with and open with even my patients too about I've had chronic physical and mental illness in my life, and so I've seen a lot of different doctors for a lot of different things and felt very brushed off, and that's really shaped the way that I've practiced. My mom was diagnosed with Crohn's disease when I was in high school, and she struggled with GI issues for so long, and it took her getting really, really, really sick for them to figure out what was going on. I've had GI issues since I was young, and it was always brushed off as it's anxiety. And my general practitioner, he said that to me, and I said, okay, I still want to see a GI specialist. It turned out I got tested. I had H. pylori, which is the bacteria that causes stomach ulcers. So, and I had a treatment resistant form, so I had to go through multiple rounds of treatment for that, in addition to other things. But that has really shaped the kind of practitioner that I am. That if you are experiencing something, it's real, and there's going to be, it's worth investigating. It doesn't.
You got to go that extra mile sometimes. Sometimes on a real busy day when somebody comes in with too many people come in with more needs, we're behind. People get upset, but it doesn't happen that often, but it happens because we have to take that time and do it right the first time, or we're gonna miss it, or we're gonna and that's that's taking the time and knowing, guiding, and making sure they know you're on the same page.
Yeah.
Why am I doing this? Why am I coming back? Why?
Yeah. Healthcare in our country is not great. Healthcare providers are and can be amazing. Healthcare system is not patient-centered. And frankly, through health insurance, they don't care about patients. You care about your bottom line.
What would be our fees without health insurance? If everybody actually paid out of pocket, would they a quarter of what they are now?
I do hear there's quite a bit. Yes.
Crazy.
Yeah.
We're
Feel
paying
free to speak more about it.
We're paying
It's
the middlemen.
interesting.
So
Yeah. Like I have read more about this.
Not the doctors are making more money. Our costs are going up. It's not coming this way.
Exactly. And it's that what happens in a lot of offices is that you have to overbook your schedule because if patients don't show up, you do not get paid. And if you get paid, it is a small fraction of what you should actually be paid. But that's the agreement that you have made with the insurance company. We do not overbook. We work on confirming with our patients, sometimes annoyingly with the emails and the text messages saying, please do show up because we are reserving this half an hour slot for you. And then that is big for us because if you don't show up, we don't get paid. But there are other offices that are booking then every 10 minutes because then if you don't show up or if you have a low reimbursement, they're still making enough to get by. And this does not leave space for humane care. That is our goal. So that's why when you're here, you are going to have this tailored experience. We're not like high rolling doctors, but
every week we also have same day urgent patients that have to be seen.
Yes.
I mean, it could be 4 one day and 0 another day, but
Yeah, I almost had a perforated cornea today.
Oh, no.
That was really rough. Yeah.
Let me ask you this. So I have when it comes to what you're about to talk about, I have no idea, but I want you to educate me. What is the funnest thing you get to work on?
Oh. So what's
Curveball. Hmm.
what's fun for me, and one of the reasons I love pediatrics, is because there is a really high reward with complicated cases. There's something called amblyopia. Most people know it as a lazy eye.
Amblyopia.
Amblyopia. It's
Okay.
what the scientific term for what most people know as a lazy eye. So the most important time for vision.
Just before you continue, a lazy eye meaning it slightly varies in comparison
I'm
to
gonna
where
tell you.
you're. Okay.
I'm gonna tell
All
you.
right.
I'm gonna
Okay.
get there.
Okay.
So the most important age for vision development is before the age of 7. That's when your brain is doing the most connecting between the eyes and the brain. If there's any reason those connections can't develop strongly because an eye is always turned in or turned out, or an eye has really a high prescription that's different from one eye than the other, or if they have something like a cataract or something health-wise going on that the vision isn't as good, the brain can learn to kind of almost ignore an eye, and that's how you get a lazy eye. So one of my favorite cases that got me into optometry when I was shadowing my previous optometrist business partner was there was a little girl. She was in 8th grade. She was 8 years old. She was behind in all of her milestones, reading, writing. They said that she was terrible behavioral issues, self-injuring. She would hit herself in the head, very disruptive during class. We do an eye exam on her. It turns out that she has a very high far-sighted prescription, which means that it's hard to see up close. So her farsightedness is so high that one of her eyes is turning in, and she's hitting her head because she's trying to turn that eye out. You put her in an accurate glasses prescription, her eyes are aligned, instantly a different person. She can see up close, so she can learn to read, she can learn to write, she can behave appropriately because she can see and do what she needs to see. That is so freaking cool that
That's nice.
he changed her life. She was written off as just a bad behavior kid. That's not a bad behavior kid. That's a kid that can't see. Kids don't know how they're supposed to see. So this is why I love doing pediatrics.
Right.
That's rad.
I have a pediatric story, a short one, because I remember a 3-year-old that was so nearsighted. I mean, couldn't even tell there was a biggie anywhere. He couldn't see the biggie if it were 5 times bigger. It was that he's not that nearsighted, and he's 3, and delayed this and that. Parents are worried. He's running around, bumping into things, kind of hyper, just doing it and not paying attention, not listening. And I'm not usually the one that gives the glasses, but I happened to do it this time. It was kind of a complicated prescription. I put the glasses on. The kid went, and he looked around, looked at everybody, and he just stopped. He stopped running around. He just walked very slowly down the hallway towards the exit and looking at his mother's going. So
Literally
that
seeing
was
for the first time.
Yeah, I mean, you can actually technically cure blindness. I mean, a lazy eye means not an eye term. It's a lay term. It means that the eye is not capable of seeing 20/20 or so. It sees a little bit reduced for one reason or another. Usually it's deprivation. It doesn't get a good sharp image. It didn't get glasses soon enough or something, But there are some people that are technically legally blind, and if you patch their good eye and get the bad eye to wake up, it's 20/20 6 months later. So that's
okay.
one time it doesn't always work out that way.
Sure.
But that's kind of nice. And for me, I see a lot of older people, and to this day, cataracts are big, and a lot of people, most people everybody gets them to a small degree. That's a discussion for another story. That's why we lose the focusing up close.
Death, taxes, and cataracts. That's what I say.
What's that?
Everybody,
Right.
Things in
Death,
life
taxes, and cataracts.
Yeah, I had that in cataracts.
When they get cloudy enough, the procedures nowadays have gotten so much more advanced. And I joke, but it's true. Almost every cataract patient is older than I am still and sees better than I do when they're out of there. I mean, and I tell them, I'm going to be jealous in your last visit, and I almost always say that. So I have to go. I can see here, but it's like
Sure, yeah.
a lot of them there.
Yeah.
You know the feeling.
There's a lot of crazy stuff that happens with eyes and vision that I don't think folks know that was within the scope of optometry. People think just glasses and contacts mostly when they think about coming to the eye doctor, but we're talking about cataracts, glaucoma, macular degeneration, changes in the back of the eye from diabetes, high blood pressure, sickle cell anemia, HIV, autoimmune diseases. Every part of your health can affect your eyes. As something as simple as dry eye to something as complicated as, retinopathy and
A
needing
couple times in my
surgery.
career, virtually the only time you can ever diagnose diabetes without taking a blood sugar is looking in the back of their eye. There's a very specific kind of retinopathy that there's nothing else like it, and their symptoms, their blood sugar's high, go to the hospital, you have diabetes. That being said, it could not show up in the eye at all. So it's not, but blood pressure does that. I've caught brain tumors. I've caught, and that's the scary part. You come in for your nice glasses exam and everything, and I tell you, you got something really bad. It happens every few months, maybe more. Yeah, but yeah. So, but it's wonderful to be able to do that. Sometimes we catch things. Heart disease all the time. I'll catch a plaque, and it just happens to go into the eye artery where I can see it. And I know exactly where it's from. It's from your carotid artery. Your cholesterol is too high. You got to get this fixed, and things like that. That happens regularly. Yeah.
I have a friend who was diagnosed with MS, and the only symptom was she was blurry in one eye.
Wow.
And looked in the back of her eye. Her optic nerve was swollen. She was not local, so I didn't see her, but she was keeping me informed of it. And I said, "When's your MRI?" And I said, let me know when you have the results. And I knew that with what she was describing, it was either she had MS or a brain tumor. Only symptom, she was blurry in one eye.
Yeah. Well, I
It's-
diagnosed my wife with MS long before she was my wife. I still remember her covering one eye and me doing fingers and her not being able to see them. I'm like, uh-oh, we're going to my office. But yeah, but she's fine. It was many, many years ago. She's fine, but we caught it early. And that's an eye symptom, optic neuritis, and that some people don't get that. But when you get it, you know exactly what it is. I mean, I knew it was before her blood work. So
You've seen so many tendencies at this point from seeing so many patients that you can catch it. You almost know what it is pretty spot on because you've seen it so many times react a certain way.
And if you talk to your patient, you listen to them, you ask the right questions, you hear them. If you do it just right, you can make the diagnosis almost without looking at them.
Correct. Yeah. It's almost looking to just confirm
what you think.
Yeah. But always, obviously, keeping an open
the time.
mind.
Go ahead and cut through if you need to. You're fine.
Yeah, go ahead.
Bye.
Yeah.
Thank you.
Bye.
Have a good night.
Thank you.
Our wonderful staff is saying
Sure.
goodbye. I'll take care of it. Don't worry about it.
Yeah. Thank you.
All right, bye.
Bye. Let me grab my water real quick. Yeah, so that must be pretty interesting to have someone come in to pick up their glasses and then you're telling them like this news of like, hey, listen, I know you're here, but you might want to get this checked out. It's pretty.
Yeah.
What was it like breaking that news for the first time?
Terrifying.
Yeah.
Being a young doctor, terrifying.
It's
But after
thankfully, I think one of the reasons I got into optometry is because there's not a lot of blood and guts and bad stuff. That's great. But the few cases you have where you're telling someone you think that they have a melanoma in their eye, or that you are concerned that they might have a brain tumor because of or you've diagnosed them with a stroke because of the changes they have in their peripheral vision. These are very challenging and delicate conversations.
Yeah, no, our visual field test can pick up those. Sometimes just by the pattern of the visual field test, we know they had a stroke on the right side of the brain on this part or whatever, or other things. Pituitary gland's a certain thing that happens. It makes a very certain specific defect. Go look at this, have an MRI, look at this part. Happens relatively regularly.
Usually with our profession too, it involves getting other specialties involved, referring to ophthalmology or co-managing with cardiology, endocrinology. But I think if you have developed that rapport with your patient and you say, if patients are ever worried, I say this, if you were my grandmother, if you were my dad, this is what I would do. And saying, I'm here. You call, text our office. You have questions, don't let them go unanswered. I think just letting people know that they are supported, that we're not just like a diagnosis and boom, you're out the door, go somewhere else, that we're going to still be here for your continued care. For that means a lot to them. It's a weird thing to give someone bad news and then for a patient to tell you, thank you for telling me. It's weird, but it happens when you can develop these kind of relationships with patients. Yeah.
And you end up being they end up being one of your dearest patients, and it happens, yeah.
Mm-hmm.
Do you? I'm just gonna ask one more question in terms of this topic because it's interesting.
Yeah.
But do you remember the first time you saw something where you learned it was another condition? Do you remember what it was? Like where you looked in the eye and you were like, "Oh, that's glaucoma," or that like
indirectly. When I was a brand new doctor, literally, I got my license like 2 weeks before, and I was working at a commercial place part time, and there was this woman that she didn't speak English. She had a collagen-based disease where the connective tissue stretches out, and that includes the white part of the eye, the sclera of the eye. So sometimes it's big. So if you ever seen on Ripley's Believe It or Not, there are people that can pop their eyes out, and they pop out 3/4. It's scary. So I go up to her. She can't stand up. I go up to her and I lean her back. I go to put drops in, and her eye went boing right at me. And I nearly fainted. And I was like, oh, because we had doctors when we were students. Oh no, where's the doctor? Oh no, I'm the doctor. So I very carefully put it back in and made a funny noise, and she just looked a little embarrassed, like it happened a lot, but she was okay.
Wow.
That was the
So when you
scariest,
say it, I'd be like,
scariest moment of my career.
Is this really what we're doing for the rest of our lives? Like that would, yeah.
But I also had somebody needed CPR in my office, and didn't make it one day. That happens sometimes too.
Mm-hmm.
Yeah, that was scary. Yeah.
Yeah. There's a few standouts for me. One would be the first time I was a first year student and I was in a clinic, and one of the attendings asked me if there was anything interesting about an eye, and I looked at it and I was perplexed. And turns out it was a prosthetic eye. So it was not. He was playing a joke on me, asking me questions about an eye, and it turned out to be a prosthetic eye. Another one that stands out is the first time I took a tick off of someone's eyelid. That stands out for me. And then another case would be when I was a fourth year in optometry school, having a patient with gnarly conjunctivitis that ended up being from chlamydia. So those are a few real standouts.
Wow.
First time when you
That's tough news to give.
Yeah. Hey, listen, I don't know what you did last week or the week before, but it must have been a lot of fun because it caught up.
There's a lot of crazy stuff you can get
I had to tell
in the eye.
I had to tell one of my kids' friends that one time, and it was confidential.
Yeah.
That was years and years ago. To this day, I don't know who I'm talking about. So
Man, it must make for some great stories in terms of once you two get together in like a room at the end of the day and just like, did you were like, So I did want to circle back to you. It said something that intrigued me, and I wanted to follow up with it. You said your parents kind of got out of the way once they realized you were like, you were that.
Yeah.
Do you remember the first moment where you were like, oh, this is the type of person I am. I'm just gonna go do it.
Yeah. I remember being in kindergarten and telling my parents, I'm gonna go to Harvard, and I was like, I'm gonna graduate first in my class, and I'm gonna go to Harvard, and I'm gonna be a doctor. And my parents were like, okay, kid. And I don't really know exactly where the drive came from. I really loved learning, and I was good at it. So I just really, I would wake up at 5 a.m. in the morning, and I would study before I went to school, and then I would do my extracurriculars, and I would come home and I'd do my homework and go to bed. Was I a little scared of putting a toe out of line? Of course, that's what happens when you have a nurse and a police officer for parents. But yeah, they, it doesn't come without, everything is give and take. So, I didn't like date as a high schooler and really into college. I graduated number one in my class in high school, got a full ride to my undergrad wow, that's
It's
graduate.
late, folks. It's late. Sorry, it's been a long day. All right,
Got a
we're
full
here after
ride
hours.
to Province College where I went to undergrad. I
Nice.
graduated first in my psychology program there, and I also studied biology. So, and then everything is, give and take. But then I didn't really date, but then I met my spouse my first year of optometry school. So things work out. But yeah, they just, once they knew that I was motivated, they just, yeah, I think they gave me a little bit of,
Guardrails.
guardrails. What
Yeah.
are the bumpers? Like bumpers, and that I was throwing strikes, so I didn't need the bumpers too much.
Nice. That's a good feeling, I think, as parents to see your child have that type of motivation, and you'd
Yeah.
be like, "Oh, you got this.
Right.
We're here if
Yeah.
you need me." But I have two kids, so like I understand.
Yeah.
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 Now you have twins,
I
right?
do.
And I
Yeah.
remember I talked to Pam, and just all the stories from the event that I
Yep.
DJ'd that I told you about.
Yeah.
What was your experience like? So you walk into Keeping Pace. What was your experience there that made you feel like, oh, Pam's like, what
Yeah.
did you experience?
Yeah. When I January 2020 found out I was pregnant with twins. Um, it ended up being the only ultrasound my husband was able to come to. Didn't know it at the time, but went to visit the old Keeping Pace location in February, and just immediately felt scooped up by. I'm sad I don't remember who was working that day, but she was incredible, and she just was like asking me so many questions about how I was feeling and letting me know about the support that they offer. And then COVID happened, everything shut down. And when they moved to their new location, which they've even since expanded in that location, and it was a instant community. And I was scared. I didn't know anybody in my family that had twins. I didn't know anybody actually that had twins. And it was during a global pandemic, and it was really, really scary. So when they started offering these moms of multiples groups again, um, Pam was running them, and she would always ask us about how we were doing, which just that is such a difference from when people check in on you and they're like, "Oh my God, the babies, whatever," and people like, "Mom is just an afterthought." And you go in there and they're like, how are you? How is this person? What can I do to support you? Let's share our stories, and let's commiserate, and let's help each other however we can, body, mind, and spirit. And so really, I think my twins were like 8 or 9 months before I could start going to those groups after COVID opened. So it was only a handful of months, but then I've been now facilitating those groups for 3.5 years. So I have moms of multiples with their babies in arms that come to class, and that's how we sit down, we settle, and I say, "Tell me, how are you doing, body, mind, and spirit? How are you doing?"
Nice.
And again, it's the same philosophy, just in a different packaging of humanizing an experience and sharing stories, and letting somebody know that you're there for them. It's the best.
Good to remember. I have two infant grandchildren.
Yeah.
I do remember that. How are
Yeah.
you doing? Hi, baby. Come over here.
Yeah.
Oh, yeah. Oh, yeah. How you doing now?
Yeah.
Yeah.
And
You need to.
yeah, and it's hard
touch
too,
yeah.
because I will be guilty of, like, when I had friends who had babies before me, and you don't know till you know about what you're
Yes.
going through.
Wow, that statement is the truest thing about parenting.
Yeah, you don't know, which is why now whenever like I'm shopping for a baby shower, I'm like, what can I get that's going to be for mom as well? Let's get her the comfy bathrobe, the comfy slippers. Let's get her some nipple butter. Let's get her the ice
Well,
packs, whatever she needs. And actually, through Keeping Pace, I did work for them early on, in my between of leaving my corporate optometry job and starting here, I actually worked for them doing some resale stuff online, and I ended up dabbling into social media. I had a TikTok account for my twins and like parenthood. Twins videos went super viral. I
Nice.
got brand deals with different breast pump and feeding companies, with different toy companies, and I was doing that for a while. So I think I've always had this like urge to create and educate and advocate, and they all kind of work together. Yeah.
And there's something to be said about, and maybe I'm speaking for myself here on
Yeah.
this, what I'm about to say, and however you would express it might be a little different, but there's something rewarding about getting that engagement and
Yeah.
feeling like the person who's actually engaging with you
Yeah.
is taking some form of content from you, like
Yeah.
they're actually understanding what you're
Yeah.
saying,
Yeah.
you know?
Yeah.
So when you end up having that viral moment, because similar to what I told you a little bit
Yeah.
on camera, what
Yeah.
got me to get into social media.
Yeah.
So when you're saying what you're saying, it only makes you want to double down
Yeah.
on the effort of what you're doing.
Yeah.
You know?
Yeah, it does make I feel like the efforts that we put in here, and when we are educating a patient and they're like, I never knew that. I'm like, okay, well, let's take that and send it to the masses, because there's so much I want
Right.
people to know about their eyes and their vision and health. And it's, there are influencers trying to be doctors, and I'm not down for that, but I'm down for doctors trying to be influencers as
Yes.
educators.
Yes. Yes. And what's interesting to me, right? Because I find that most people who are good doctors will end up hiring someone to educate them on social media. And once they grasp the massive audience that's available to them
Mm-hmm.
You
in
talk
terms
about
of
me.
social, huh?
You talk
Oh,
about
no,
me.
I'm talking about
You are
everybody
talking
I
about
work
me.
with, okay? Everybody, because the thing is, once you have a successful business and that word of mouth gets out, social media almost seems like an afterthought to you because you already have a successful business. And I experienced that a lot, where the people that I'm going to interview or something like that, they necessarily look at it like, I've built my business. This is a feature to which I add to my business. Versus I look at it like, this feature could add so much racing fuel to your car
Right.
in terms of what it could do. So I say it more because I think I'm obsessed with the inner workings of it all.
Right.
Yeah.
So when she says like, oh, she went viral, I'm like, tell me word for word, what
Yeah.
did you write? How did you do
Yeah.
it? What did you know what I mean? Like that's
There's-
the
Yeah.
thought behind
It's
it.
also the grand frustration, because you want it to be a recipe, and you're
Yes.
like, because I've had some of the videos that we made, which I'll show you someday. I've had the ones that are the most popular, not the ones I thought were necessarily
Oh my
the
God.
best.
Yes.
And then I'm like, but why? And also this video that got no views. This is so
I
funny.
edited my heart out.
Oh,
I
what do you-
edited my heart out.
Yeah, it's a fickle beast,
Yeah.
but it's fun. Thankfully, we have one of our new hires too. She is a Gen Z big meme person, and that's how she and I communicate. And so she has been very on board with helping me film all these silly
Nice.
things. This Jaden.
Nice.
Oh, good. Okay.
Yeah. So yeah, it's also just again another way to not take things so seriously and have fun, at the same time being educational and having real value.
And being a family, our office manager, Melissa, and they've been with us, like I said, for the whole time. They've been with me for 30 plus years, and
Yeah.
we know each other. I've known them longer than my wife and kids, for crying out loud. So it's that long,
Yeah.
and we take care of each other, and that's the whole point. It's, we value our employees. We value we cross teach them. But the more they know what we're doing, the better. The more they're into it, the better they feel about themselves. The more we treat them like professionals, and it works. It works well.
Do you think, you've built that type of environment and defined it more because you had 6 kids, or do you feel like it was something you always kind of had a good gauge on, and then you kind of just taught your kids the environment? Was it like you refined the process? Like, I'm always curious, you know?
I've always kind of had a soft heart, and I don't want to hurt anybody's feelings, and I don't. I mean, I've had really tough jobs, and I've had really bad bosses. Probably why I end up being self-employed eventually. I
Yes.
could never not. I didn't do well not being the boss.
Mhm.
I lost my thought.
Your kids and just how you were always soft-hearted beforehand
Yeah, I mean,
already.
I guess I just was part of me. I mean, I just can't look somebody in the eye and not help them, because you understand each other. I understand people, emotionally, and just the way I've always been. I don't know, so.
What is it like having 6? You said 6 kids, right?
Yes,
That's
3
all
are
right.
mine, 3 are hers. It's
Okay.
our second marriage.
Nice, nice.
Everybody loves each other. We're lucky. It worked
Yeah.
out well. We've been married almost 17 years now, and
Congrats.
and with 2 grandkids and counting, and we have got 4 daughters-in-law, or one's a future daughter-in-law, and
Spoiler alert.
so yeah. And then I have
You
another.
should be expecting a lot of grandbabies, is what I'm understanding. You did some math there.
One son's getting married next fall, and another son's getting married the next fall. So yeah,
Yeah.
it's starting
In
to
a
rain
few more
grandkids.
years, these kids are going to start popping out left and
Yeah.
right.
Yeah. He thought that he was going to get a break by bringing somebody on to help him with patients, and you
Thank God I got you when I did.
you got a couple months of a few days off, and then they put him back to work watching.
Right. Now
watching
I'm
babies.
watching my grandson a couple mornings.
Yeah. I feel like that's pretty. Isn't that the goal of what we're trying to do anyway, though?
Yeah.
Right? Like,
Yeah.
isn't it kind of
Influence
like-
them.
Yeah.
I want them to know. I want to know them. I want them to know me very well. I want to,
Yeah.
just get on the same page.
What do you, kind of tying into how your grandfather was with you, what do you think you're going to try to teach them so that they'll talk about you in the future of lessons you taught them?
Hopefully, I've already done that.
Sure.
They're
Okay,
all. We were very close, my sons and I. We
I mean, your grandkids. Your grandkids.
oh.
So you being a grandfather,
Well,
your
they're so
grandkids.
young now that yes, I have to kind of start again. But I can see already my sons, my influence of my sons, and how they treat them, how gentle they are, and I was not afraid to change a diaper, not afraid to, that kind of thing, and they're just like that. They're right in there with so yeah. I mean, I'm blessed. I can see everything.
He's already taken his grandson out for walks on the,
Oh,
in
yes,
the big backpack. They go
which
for
I
a
used to do
walk.
with all 3 of my sons.
Yeah.
They're within 7 years of each other. My blood sons. And I used to take them in the backpack for a long time. So I started doing that with my grandson. Oh my God, it's a lot harder than I remember. I almost died going up the hill the first time, but I'm getting better. So I'm starting to get out with him.
You gotta pick the muscle memory back
Yeah.
up and do the whole thing. Yeah.
He already worked on teaching my twins with swimming, and he's
Oh,
so
right.
good with my kids. So I know that he's an awesome grandfather.
Nice.
Yeah.
Nice. Yeah, I sometimes will think about, my daughter's only 18, so I'm getting ahead of myself by many, many years. But I'll think about, like, how am I going to be as a
Yeah.
granddad, because I see how my mom is with my kids.
Yeah.
And she just spoils them. But she would whoop my ass when I was younger.
Yeah,
if I acted
no,
out.
of
You know what I mean? Like,
course.
it's such a opposite sides of
I don't
growth.
spoil. Well, it's too early yet, but I don't spoil them. But I don't fight as many battles. Mom's coming.
Yeah. I don't need to handle this. This is my.
I'll handle it to a point.
I'm just gonna quick step out so I can say goodnight to my kids. If that's
You're gonna say,
cool.
absolutely,
I'm gonna just leave
absolutely,
it
yeah.
for a second.
No,
Sorry.
you're good.
Tell
You're
them
good.
good night.
We're wrapping up soon, so yeah, no problem. So now for yourself, right? When you look at your practice, you've been doing it for so many years. What motivates you to still stay at the top of your game? Like, what is it that you wake up in the morning and you're like, I'm gonna look sharp. I'm gonna look like I'm gonna walk out of here ready to conquer my day, type of thing.
Because I know my patients. I literally see at least 10 of my previous patients more a day. And I know most of them I like. I can't think of too many I don't like. And it's just nice. the whole world sits in my chair. Basically, I learned about the most um, strangest jobs you never think of. They make this part for this or this. You never think of the, and various visual needs and just hobbies or where the places travel. What they tell me all about every place in the world, and I have kids that are now bringing their kids to me. Their kids are older than they were when they came in, and they've gone off somewhere in the part of the country and come back, and so yeah, the whole world literally sits in my chair in a small town, which is really cool, and that makes it hard to get. That makes it not so boring. I don't get bored. It's always something different, and you never know. As an eye doctor, I may have a kid with turned eyes. I have to play with special lenses and prisms, or I may have somebody with really bad injury that I have to remove metal from their eyes or something, or a retinal detachment. You just never know when I turn the corner and look who's sitting in the chair, and I know I'm helping my patients, and I know that's kind of my calling in life, so that's what I've done forever, and and now it's just that and being a grandfather, and yeah, that's about it.
Right. It seems like you've gotten to a very comfortable place with the business of aspect of it. You're very aware of the emotional aspect of it in terms of not only what your client needs, but how your client's going to, if you treat your client right, their kid and their kid's kid, if done right, will all want to come here because of how you've treated them all these years.
That was always a simple thing. If you don't need glasses, I'm not going to try to sell you glasses. Down the road when you need them, you're going to trust me. I mean, I don't know. Honestly, I mean, she loves optical. I'm not so much. I'm expert enough on it, but I sell glasses because I have to. I'm more into the other things, but yeah, make sure everybody gets what they need here, and if I'm not enthusiastic about one thing, she is, or so there's always somebody that's on their game here to give you what you need.
Right, right. Well, as we wrap up here now that we have you back, so I usually go about an hour. It looks like we're about to hit that mark, give or take. So this is what I like to kind of wrap up with, and I'd love each of kind of your replies on it. When you look at how your life has played out so far, and all the lessons you've learned throughout the period of time, if you could only boil it down to one lesson, and then everything else that you've learned disappears. You only have this one lesson. The clock rewinds to day one, where you're going to start building this dream life of yours again to get to this point. What is the lesson you started all with? What is the base?
The simple, the golden rule: do unto others as not I'd like done to me, but as they'd like done to them. Treat them as give them what they need, understand them, communicate, be upfront, no games. That's it.
That's a hard one. Similarly is, I think leading with love and finding, because if you can love yourself and love what you are doing and find the good in other people, you'll get that in return. And yeah.
Now,
I don't think it's as
no,
it's
no,
not as
no, it does.
point as I'd
No.
want it to say, but that's a big journey and loving yourself and
Yeah.
And I'm just going to ask one follow-up to
yeah.
that. Is there an example to which there's a reason that's the rule that you want to take with you? Like, is there something that happened that made you be like, this is what I know to be what will work for me?
I think for me, with my experiences, as I had mentioned, with my physical and mental health journeys, a lot of my inner world did not match my outer world. How I was feeling inside was not how people were seeing me on the outside. I always am come off very happy and bubbly, and but didn't like myself inside. But now, especially now that I'm raising children, they're so easy to love and they're amazing. And I want that for them. So I've been feeling that for myself. Like I can actually love myself, and that makes other things better. So if you can fill your cup and stay true to who you are, it comes back in multitudes.
As a younger man, I mean, I've been sort of misled by religion of different opinions, and I have different family members that are different religion and or no religion, or and that's been difficult for me to know what's true and not, and who to trust as a young man, and but I know good from bad. I just feel that this is what to do. I can't live with myself if I find somebody's money on the sidewalk, I take it. I couldn't live with myself. It's not worth it. I don't know. My father died when I was very young. It was kind of a hard childhood, we'll say, and I wanted to have a different experience for my kids. Let's put it that way. That's another part of it.
Right. So it's kind of what you grew up experiencing that ended up.
Right. I kind of, I wanted to be the father I never had. I was only 3 when he died, and I never quite understood what happened. Because I'm much younger than my siblings. But anyway.
Right. Well, you became the version of yourself that you wanted to be, right? It's for your kids. Yeah, no, I get that. And that's, from what you guys say, it fits into your business very much. It's very emotionally driven connections that end up getting you to where you want, again, from what you're saying. And it's nice to hear. I'm an hour and a half away, so once again, it's a little difficult to get out here. But I think anybody who's in this area is very lucky to have you both here in terms of what you've said to me, what I've experienced. You've been very great to me.
Thank you.
So I thank you for that. Before we wrap up, social media handles, websites, can they find you?
Sure. So Bukowski and Sexton Eye Care, 770 Broadway, Suite 6, Raynham, Massachusetts. Our website is BukowskiSextonEyeCare.com. All of our socials are Bukowski Sexton Eye, at Bukowski Sexton Eye. Follow us on Instagram.
And you should. You should.
It's
very good managed page.
Thank you.
I'm a fan.
Thank
I'm
you.
a fan. But other than that, thank you so much for your time. I appreciate it. Folks, I'll see y'all later. Have a good one. Bye.
Thank you for all the thoughtful questions.
Yes,
that was
good.
fabulous. Yeah.